Hi, my name is Katie. I'm going to be your nurse today. How are you feeling?
I have a lot of shortness of breath ever since that blood transfusion.
She's also been really confused. She says stuff that doesn't make any sense.
Okay. Well, to help you breathe a little bit better, we're going to raise the head of your bed up. I'm just going to give you an extra pillow here. Okay. And I'm also going to see if I can get an order in for oxygen. And then I'm also going to have you squeeze my hands as tight as you can, okay?
Why does she need oxygen? Is she going to be okay?
She's going to be all right. It's just to help make sure that she's getting enough oxygen, help make her feel a little bit better, maybe regain some strength.
Okay. Well, let's shake a leg here because she can't breathe.
Okay, I also noticed that you're a little bit pale. Are you feeling okay?
No, I'm so weak and I'm so tired. I don't have any energy. Can't even pick up my own glass of water.
Okay, I'm just going to do a couple quick things then. So I'm going to put a pulse ox on one of your fingers and just going to monitor how much oxygen you have going through your blood. And I'm also going to do a cap refill on each hand. Okay, and then I'm also going to take your temperature real quick. So if you just hold this under your tongue.
She gets really insecure when you call her pale. That's why she spray tans and tells people she's Puerto Rican.
Oh, I'm sorry, I didn't mean to offend. Alright,
Hey, everyone does it.
so I'm going to have the hematologist come in right now, okay? I'll be back in a little bit to check on you again.
Okay.
Hi, I'm Kristen. I'm going to just draw your blood today, so then we can take it down to the lab and make sure you're doing all right. Are you feeling all right? You look pale.
Yeah, I'm really tired.
Okay. We'll get you feeling better.
Ring, ring. Hi, doctor. This is Katie, an RN. I was just calling to talk to you about the patient in room 201. She's a little bit pale, has a low pulse ox of about 90. Her cap refill is 5 seconds. Her temperature is 96.8 oral. She is short of breath and is a little bit weak. Do you think you can come up and talk about the patient's plan of care?
Certainly. I'll be right up.
Okay, we'll get this down to the lab and we'll have results back to you soon. Okay?
Hi again. I just got off the phone with the doctor and he's going to be coming in soon to talk about your plan of care.
Why is the doctor coming in? Is everything okay?
Everything's fine. The doctor just wants to make sure that we get the best plan of care for your mom.
Okay, well, she better hurry.
Hi, I'm Mackenzie and I'm your doctor. I understand that you have some uncomfortable symptoms today.
Yeah.
I reviewed your blood results from the lab and also your plan of care currently, and it looks like you have a type of anemia that is from your blood transfusion. The cells that we have given you in your transfusion have been attacked by what your own body produces, and so what we're going to do is we're going to help treat those symptoms and make you feel a little bit better.
So, does this mean I'm going to die?
No, you're not going to die. We're going to give you some medications to help you feel better, and then we can incorporate your plan of care around that.
So what exactly are you going to be doing?
We're going to be giving your mother some corticosteroids, which are going to help decrease the reaction of the blood from the transfusion and her own blood have been mixing together. And we're also going to create an order for oxygen so that we can get your perfusion of oxygen through your body going, and that way you don't feel so tired and weak.
Good.
Okay, and I'll have the nurse come right back in, and she is going to discuss what she's going to do with you.
Okay.
Okay.
Alright, hi again. So, like the doctor was saying, I'm going to make sure that I keep checking your temperature, make sure that it stays where it should be about once we get it raised up again. So if you ever feel a little bit chilly, just let me know and I'll bring in extra blankets, turn up the thermometer in the room, whatever you need to be comfortable. And then I'm also going to make sure as soon as the order for oxygen comes through that I get that on you so that you can start breathing a little bit better, okay?
Okay, good.
Alright. Can I get you anything right now?
No, not right now.
No, we're okay.
Alright. Well, I'll be back soon to check on you, and in the meantime, the hematologist is going to come in and talk to you about your lab results, okay?
Okay.
Hi, it's me again. I got your lab results back, and it seems that you have a decreased hemoglobin. That's just the decreased amount of oxygen binding to your red blood cells. And then you also have a decreased hematocrit, which is the mean amount of red blood cells you have. And then you also have an increased bilirubin. And has the doctor been in to talk to you about your plan of treatment yet?
Yeah.
Oh, okay, so that's being taken care of. Okay, just wanted to make sure.
Mhm.
Do you have any further questions?
No, the doctor explained a lot of it.
Okay.
Yeah.
You need to stop spray tanning.
Can't.
You're not Puerto Rican.
All right, doctor. So I think the best nursing diagnosis for this patient would be ineffective tissue perfusion related to a compromised oxygen transport system secondary to anemia, as evidenced by her shortness of breath, the pulse ox of 90, the cap refill time of 5 seconds, skin pallor, a body temp of 96.8 orally, hemoglobin of 9 grams per deciliter, and a hematocrit of 28. Some interventions that I think would be beneficial for the patient would be the administration of the prescribed amount of oxygen that you had in cases where her oxygen drops below 95%. Also making sure that we maintain her body temperature of at least 98 degrees, so keep the warm blankets and appropriate clothing. I would also recommend that we raise the head of the bed between 30 to 45 degrees at all times, just so that she gets the proper amount of oxygenation. I will make sure that I instruct the patient to measure the temperature of her bath water using a thermometer, and I will also make sure that I prescribe the medications, the corticosteroids that you had prescribed, and any other treatments you ordered.
Okay. And will you be doing some education with the medication as well?
Absolutely.
Okay. Let me know if anything changes in the plan of care or if there's any concerns that I need to be notified right away.
All right, we'll do that. Thank you, doctor.
Thank you.